Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation this morning will be delivered by Pastor Eric Gromberg from the Trinity Lutheran Church in Fort Worth. Thank you very much for coming out today. Appreciate that.
Thank you. Pleasure to be here with you all. Let us pray. Gracious God, you have sent the prophets to proclaim to the leaders of the people to do justice, to serve with equality, to work for the good of the city, the county, the good of the people. And so we ask that your Spirit would be upon this gathering today, that you might guide our leaders as they make decisions for the good of the people, that they might always seek to serve especially those on the margins, the least and the lost, the widow and the orphan. Guide us, O God. Keep us in your care, and help us to serve one another and to live in community and service. In Jesus' name I pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. On the Texas flag, I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Pastor, thank you for coming out today.
Thank you, sir.
Thank you very much.
Agenda announcements. Mr. Manius.
Thank you, Your Honor. We have a fairly large number of agenda announcements. If you'll go to your red folder, and we have included a copy of the agenda so that you can see those different announcements. The first, I'll go through them fairly quickly. In the Administrator's section, item 9A1, we're going to hold that until after closed session today. Under the Administrator's section, item 9A8, we're going to hold that until next week. On page 4 of your agenda, under Budget and Risk Management, item 9C1, there is a revised court communication as it relates to that particular item. Under Facilities Management, item 9E1, we're going to take that up after closed session today. Under Human Resources, item 9F2, that will also be considered after closed today. Under Information Technology, item 9G1, we're going to hold that for a week. And finally, members of the court, under Purchasing, item 9I1, this is a revised court communication as it relates to the sale of recycled paper. I apologize for all the different changes. As you know, we didn't meet last week, but there are a lot of things that we need to take care of, and there's some items that we need to talk to the court about in close before we ask you to take any action in open. Also, Your Honor, you might want to take this opportunity to tell us a little bit about the NACO conference.
I will be glad to do that. I cannot begin to thank everybody in the county who helped, who volunteered of their time and helped on that. Truly, everyone who came up to me just kept ranting and raving about the purple shirts and the folks who helped with the conference. Everyone said it was the best conference that they could remember, and it really would not have been such had we not had the help of everybody volunteering, and then also the sponsors that we had been able to arrange. I think everybody had a great time at the conference. We had some great events, the board reception, and then the final night at Billy Bob's went over very well. I don't think, I mean, they had that stuffed bull. I never went by that stuffed bull. There wasn't an hour in line waiting to get a picture on that thing. You know, it was amazing, but we had the pack green, the band, the bull riding professional bull riding, and then people getting up on that bull. I think everybody had a great time, and our attendance was probably 300 to 400 more than what it had been in recent years. We probably had close to 600 or 700 more at the closing event than what we had before. So I want to thank everyone. I especially want to thank Jim Duff and Tom and Natalie, Carolyn and Ann, really everybody. It's hard to start because once you start, everybody did so much for that, and we just are very, very appreciative. And people are already saying, well, when are you going to have us back to Fort Worth? And I'm saying, yeah, well, y'all are already planned out for the next 5 years. We'll talk about it in 5 years. Maybe by then we might be ready. So, but again, I want to thank each one of you for the help you gave in that, and I hope you enjoyed it.
Well, I really enjoyed it, and I want to thank you, Judge, for taking leadership in this, and the members of your staff, too. I mean, you guys really make us look good, so thank you for that.
It was really everybody. I mean, I really mean this when I say it was everybody, because your folks helped, Ann and the folks at folks in the hotels, the folks in the conference centers. A lot of those folks were there at 6:30 in the morning, and they were there at 5:30.
That was mainly Precinct 1. With the 6:30 in the morning shift.
I saw another side of Carolyn.
I think Carolyn might argue that, and there might be a few other folks. I was down there at 6:30 just about every morning.
She was really cracking the whip.
Alice was too.
Yeah, it was everybody. I mean, I really can't even begin to express the thanks and to tell you how impressed everybody was. The comment I kept getting was, first off, the purple shirts were a great idea. And secondly, we didn't have to go up to them to ask the questions. They were coming up to us and saying, where are you going? What can we help you with? And if there was a question or a concern, they would literally take the person to the place to find the answer and not just point them in a direction and say, go find it. And that was the kind of hospitality I knew. And they said the same thing, even walking the streets, they said, Fort Worth is such a friendly place. He said, even the people that weren't in the purple shirts would talk to us. And that was something that they appreciated. The mollies, folks getting on the mollies, we had purple shirts on the mollies also. And it was just one of those things where I can't say enough good things about our employees and the way they treated folks and what the folks had to say about this event. And I've had a couple of calls from folks around the country, as well as notes that have come in, that have, again, said this was the best NACO conference that they could ever remember. So I think that New Orleans next year is going to have a pretty hard road to climb to get near us. And even if it is New Orleans, I think they're going to have a hard time getting there. So again, thank you all for everything. It was a great success.
In addition, Judge, I'd like to thank those among our staff who served as expert presenters, moderating sessions. We had a very excellent tour of the JPS Health Network, both the hospital itself and the Trinity Springs Behavioral Health Unit. Les Smith did a presentation on human trafficking. I believe Lou Brewer was involved in presenting. Just a variety of people from across the county served as local subject matter experts.
And even Robert Early with his pet fly did a moderated a panel. And I also want to thank facilities. Once again, David, you and your folks did a super job as far as helping move water around and helping just to be there to help all around on that deal. So it was a team effort, just like we always are. We worked together and and it was a team success, and it wouldn't have been a success without everybody's help. So thank you once again, and with that, we'll move to the approval of the minutes of our July 16th meeting.
So moved.
Second.
We have a motion a second. Any discussion? Please vote. Motion passes unanimously. I believe we have one proclamation. Commissioner Brooks.
We do, Your Honor. On July the 18th, Nelson Mandela had his 95th birthday. And we presented this proclamation to be added with those from around the region and around the world to wish him good health and good fortune on the occasion of his 95th birthday. So I would move ratification of this proclamation.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Members, you have before you the consent agenda with the changes that were indicated earlier.
Move for approval.
Second.
We have a motion and a second to approve the consent agenda. Any discussion? Please vote. Motion passes unanimously. Mr. Manius?
Thank you, Your Honor. Members of the court, if we can go to item number 2 under the administrator's section, we're requesting that the court approve a contract between Tarrant County and North Central Texas Council of Governments as it relates to access to the cooperative data program.
Move for approval.
Second.
We have a motion and a second. Any discussion?
How do we access to that data? Is there a login credential that we can
Yes,
obtain?
I can send you a link and some information.
Okay.
Why don't you
Thank
send
you.
it to all the court?
Yeah, I will.
Any further discussion? Please vote. Motion passes unanimously.
Thank you, Your Honor.
Thank you. Ms. Tidwell?
Good morning. We're asking the court this morning to receive and file the Tarrant County financial statements for the period ended June 2013.
So move.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Mr. Wright?
Thank you, Your Honor. We have a check for acceptance by the court in the amount of $96,839.26. Our portion of a settlement, and it's under item D1 of the District Attorney's Office.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Phillips?
Good morning.
Good morning.
Good morning.
It is requested that Commissioners Court approve a professional services contract with O'Connor Architectural and Interior Design for architectural and engineering services related to the renovation of the Plaza Building's 6th floor for the District Attorney's Office Investigative Unit.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Ms. Worthy? Good morning.
Good morning.
Our first item is to request that you receive and file the personnel agenda.
So move.
Second.
We have a motion and a second to receive and file the personnel agenda. Any discussion? Please vote. Motion passes unanimously.
Our next item is it's requested that the Commissioners Court approve the professional services contract with ABBA Staffing Consulting and ADA Staff to assist Human Resources Department with typing tests. These are our contracts with off-site services for applicants to take typing tests that might not want to come downtown. These services do charge a fee. They're located in Arlington, Dallas, and Bedford, and we do have a lot of usage of these services.
Move for approval.
Second.
We have a motion and a second. Any discussion? Is this typing or is this keyboarding?
Well, it's a typing test that's given on a computer. I mean, it's a computer keyboard, a computer screen that they type on, but it's still called
It's not a typewriter.
No, sir. No, we finally did
I was going
leave
to say,
that.
if we have anybody that is using a typewriter now
No, sir.
on a regular, I know we still use them. I've got them in my office, but we don't have anything in there where people are really typing anything much more than a
Form
line or filling in a space.
Correct. Yeah,
Mr. Johnson, you still using a typewriter?
If I want to, I can.
Okay. Please vote. Motion passes unanimously.
Our next item is approval of a change to the table of organization for one new project position with public health. This would be effective July the 31st. This is a position to coordinate health information exchange project and activities. It is grant-funded. The cost is a little over, or nearly $12,000.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Mr. Beecham?
Good morning. We have two items for your consideration this morning. Our first item is a bid award recommendation for bid 2013-115, sale of recycled paper. A recommendation be to award this to the high bidder on a per unit price basis, awarding Evergreen Fiber Sales the sale of sorted white ledger at the rate of $230 per ton.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our last item, our second item and last item, we're asking the court to grant an exemption to the competitive bidding requirements. They're allowable under Section 262.024A2 of Vernon, Texas codes, the purchase of drug standards and controls to ensure conclusions that are accurate for toxicology results for the ME's office.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Jack, do you have a list of the items that's going to be included in the sale that's coming up?
Yes, sir. I should receive the flyers either today or tomorrow, but I can get you another list today.
Well, no rush, but people are asking me about it. So.
Yes, sir. They are online on Renee Bates' website at the present time, but again, the flyers should be here. I'll get them to you as quick as they come in.
All right. Thank you.
Yes, sir.
Are there any appointments today? Being none, then we will move on to the approval of the claims, including the addendum.
So moved.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Briefing items, Mr. Manius.
Thank you, Your Honor. We have several items to bring to the court this morning. The first item, item A, is an update, to the monthly update from the hospital district. Mr. Early is here to report at this time.
Thank you, Judge. Thank you, Commissioners.
Good morning, Robert.
Good morning. I, too, wanted to compliment you all on the NACO conference. From what I saw and when I was around, it just could not have gone better. You all were an incredibly great representation for us, and I think the community owes you a debt of gratitude for what you represented and how Tarrant County was represented. It was well done. Every aspect of it was well done, and we were happy to participate, and thank you for the invitation, and thank you for the invitation. A couple things, and my briefing will be short today, but you know, it's always interesting when you have an organization with 5,000 people in it and you tend to do a lot of things during the day, is there's a variety of rumors that happen, and you just can't seem to stop them. If we were as effective at some other things at JPS as we are rumors, we would be stellar. It is amazing, some of the things that come out of there. But about a month and a half ago, my chief financial officer, David Salisbury, came to me and said he wanted to make some changes in his life. He wanted to do a few things differently. His daughter had gotten married, his son had graduated from college, and he was a true empty nester. And so he came to me and said...
Tell him to just hold that thought.
Yes, I understand. He and his wife, Jennifer, would like to do a few things differently, and so he suggested to me that maybe he would like to go and do some consulting and not be the daily activities of a CFO and deal with all the aspects of what it takes to deal with that. I have an immeasurable amount of respect for David, and I think he's a great addition to our organization. He has been for the last 4 years. But anybody that wants to do something differently with their life and they think it's going to bring them more joy, I'm going to be supportive of it, and I'm going to do anything I can to help him. There have been some rumors that he's being run out of the organization. To dispel that, I'll tell you publicly, no, that's not the case. And secondly, I don't think he's going to depart until the beginning of next year because we've got to go through a search to do that. And I've asked David if he would be happy to help us out in that search, and he said yes. And I said, then would you stay enough for 2 to 3 months to help that person understand JPS? And he said yes. So there isn't any interest in having him leave. But if he is going to leave, I want to make it as smoothly as possible for him and his family And then I want to figure out how the next CFO operates for JPS, because we have put in some things that are significantly different in the last 4 years than what JPS was used to running with, and I want to continue that. The other thing that's of interest is, and you all face this sometimes when you deal with county issues, is we have 18 different contracts with physician groups at JPS. We're going to, because those contracts, a bulk of them are up at the latter part of September, some are up at the beginning of the year, and some are up in the middle of 2014. We're going to begin to review those contracts and figure out what we do. I think that you all as commissioners will probably get some phone calls and some concerns about that. Feel free to communicate with us. We've been very upfront with dealing with our physicians the best we can. And what we have done for the past 6 months is collect data, how many visits they see, when those visits are on time, when those visits are delayed, what our OR time is, what our turnaround time is, what our failures as an organization are, what they may be coming up short with. There's two overriding aspects to physician groups. One, and a total alignment to dealing with our patients. How are we making sure that we give the best care we possibly can to our patients? And that means alignment. That means Group A and Group B aren't doing something differently on how they treat our patients. If one group sees 20 patients a day and the other group seeing 10 patients a day in our clinics, we need to align that. If some groups have a time period by which you have 3 months to your next appointment, that's not tolerable. And we want to make sure that that's in line with those that are trying to get it within 3 days and 4 days and 5 days. So the first thing is alignment, and the second aspect is performance. What are your performance standards? What are your outcomes? What are your left without being seen rates? What are the issues that we face with return visits to the hospital? What are you doing with falls and septic issues that we have, and all those type things that we have, sepsis and everything that we have throughout the system we need to deal with. So what we're going to try to do is align those contracts. When you do that, though, there'll be a great deal of rumors that we're doing this or we're doing that. Nothing's draconian. Everything's designed for the patient focus, and the patient focus ultimately will be for the betterment of the physician and who we deal with. You can't change contracts without somebody getting a bit antsy, but some of those contracts will just be additional performance measures. And I think that is not only the wave of JPS, which is where I think you and our board wants us to be, but I think it's the wave of the nation. I don't know that you're going to join an organization that says we really don't care about your physician satisfaction scores and we really don't care about your outcomes, so please come work here. I think those days are long gone, and they should be. And JPS, I think, is making a bold statement and going to the forward to do that. I do think, however, that our relationship with the University of North Texas Health Science Center will certainly be enhanced. I look forward to that. I think we have got some leadership over there that is not only full of integrity, but full of great vision and ideas, and I want to not only reward that, but I want to partner with that from the standpoint of research and other things. The last thing I'll tell you about physician contracts is whatever physicians went through in the past, and I'm not quite sure what that was, we weren't a part of it. And so I don't want to get labeled for issues and problems that took place in the past and be put in the same situation. It's not where we are, and that's not the approach we take to our physicians, although some will probably communicate with you and tell you such. My comment to y'all is when they communicate with you, feel free to call us. We'll be happy to address any issue along with our physicians and helping you all go through this process. We'll keep you up to date as much as we possibly can, but at this point, all we've been doing is gathering data. So, Judge and Commissioners, that's all I have for you today in my briefing, and I always want to be up front with y'all as well as the public. And Carolyn, the fly reference was on the panel. We just had this huge fly that kept flying around us. I didn't bring a pet fly. I don't have one. So just wanted to make sure. So
I wanted to thank you for your references to the University of North Texas Health Science Center and the new leadership and new vision that institution has. And I'm glad to hear that JPS is willing to partner to help make that a successful relationship for the overall health care of the citizens of Tarrant County. So
good.
Thank you for that.
Thank you very much. Anything else y'all have?
Thank you, Robert.
Thank you all very much.
Appreciate everything y'all
Appreciate
do.
it.
Members of the court, if we could go to item B. This is an update from the Health Department on cyclosporosis.
That's easy for you to say.
Mr. Jones is here to address the court. Sorry about that.
Cyclosporiasis.
That's why I was going to let you introduce this item and not me.
I've been practicing for a week, so good morning, Judge, Commissioner.
Good morning.
Just want to give you an update on a multi-state outbreak of a diarrheal illness caused by a single-cell parasite that's affecting our Tarrant County residents. What it is, what it's doing, what we're doing about it, and take your questions. The CDC is reporting about 353 cases as of yesterday. Iowa's leading that with about 120, a little over cases since June. Texas follows with 101 as of yesterday. And in Tarrant County, we've had 28 reported here. The North Texas counties, Dallas, Denton, Collin, and Tarrant, have about 75% or more of those cases in Texas. So whatever's going on appears to be concentrated here for us. Iowa and Nebraska have been going on a little longer. And so they've got a little more data, but a little bit about the disease. If you've heard of traveler's disease, if you go to Latin America, tropical areas, that can be caused by several different things, but one of them that's commonly caused traveler's disease is this organism, Cyclospora, which is easier to pronounce.
Thank you.
You're welcome. And so people come back usually about a week after they ingest it. They start getting sick, watery diarrhea, and everyone has a problem with diarrhea every now and then, but this one tends to relapse, and if a person has a problem with it, it can last up to 10 weeks. Others may not get any symptoms, so it's a little difficult to track sometimes. What makes it different in the United States is we don't see it often. The first time it showed up here was in 1996. We had 1,500 people sick, and Texas was kind of the epicenter. It was a result of imported food. And that's why when you read about this on the internet or in this bulletin that we try to hand you guys so you have that, imported foods are often implicated because of the water systems there, contaminating the food. Then when it gets here, someone ingests it. So at this point, we've got 28 cases. We're up to 16 that have been investigated, waiting for calls back and trying to call them. 60% of them are women, and that might be a clue that we're looking at fresh produce again. Unfortunately, those of us who are male tend to eat more meat than we do the good things for us. And in this case, that's an advantage. The age range here in Tarrant County has been 10 years to 72 years of age. Average age is 50 years. So it's a little older group that's getting sick and being reported. In Nebraska and Iowa, it seems like the peak has hit with about the third or fourth week of June, and our cases are clustering around that time frame too. But our latest case onset was July 11th, and we've got more cases to investigate, so it could move a little bit. Whether we're involved or we have the same source with Nebraska and Iowa, and there are 14 states involved, is not known for sure, but that's the assumption. So FDA, what they've been able to tell us, they're trying to track back on certain produce items to see who the distributors are and where the growers are. Because the feeling is it's either one or just a very few growers that are probably in the distribution channel. They had this product go through, it's moved through, people got sick. But the concern is if they are growing something else or they continue to supply into the distribution channel with contaminated water on their produce, we'll still see cases. So that's a little bit about the organism, what we're seeing in Tarrant County. What questions do you have that you would like answered?
What does John Q. Public do about this to try to avoid the disease? Is there anything that one can do?
Well, what we're telling people, and it doesn't eliminate the risk entirely, it's just to wash your fruits and vegetables very well. The idea is to wash off the sporocysts that are on there. You can't see them. And reduce that number if they happen to be there, or eliminate them, and that'll prevent you from probably getting sick, but it doesn't eliminate it. And I said something earlier, I don't mean to implicate all imported food. We certainly had our problems here in the U.S. with some of our agricultural practices. And so I'm not saying give up fresh produce or vegetables. That's not our message. Just wash it. And hopefully that'll reduce it.
How do you treat it?
There is Bactrim, Septra, Pediazole. Those are the same combination drug. That's what the CDC recommends. If you have a sulfa drug intolerance, then you're probably less likely to be treated. and you're going to have to probably just let it run its course. It's considered self-limiting. The hallmark of this disease is weight loss, 10, 20 pounds. Not a good way to lose your weight.
I'm glad you added that.
Yeah,
because-
so you don't want it. It's you lose your appetite. So in case the diarrhea is explosive, you don't want to eat for weeks at a time. Literally, you just don't eat, and people lose quite a bit of weight. So
Thank you for your very graphic presentation.
we're just thankful I didn't have a PowerPoint.
Yeah, we are. And someone, if they begin to experience, they should go ahead and get to the doctor and let the doctor, is the doctor going to be able to, in the early stages, determine that this is what the individual has?
And it's a pretty simple thing. If they take a stool sample, send it to the laboratory and ask for an ovum parasite, and specifically ask to look for cyclospora, they can do a microscopy exam and look for it. There's a couple of tests under the microscope they can do. So what generally, if a person's had diarrhea more than a couple, 3 days, they should go see their doctor. And there's a risk for dehydration, and have the doctor look at it. We have, lots of other things that cause diarrhea. Salmonellosis and Campylobacter are going on all the time. And this just happens to be a new one on the block that's unique and that can last for a long time.
And again, this is not contagious.
Usually
It's just-
not.
It's usually just something you're going to pick up as an individual from something that you ate or something along that line.
And that's due to the life cycle of the bug. Person-to-person transmission is not thought to be a real concern because it takes about a week, a few days to be in the environment before it becomes infectious on the food. And the bad news is the only reservoir we know are other humans. So if you eat something in food, that's because it came from another person somewhere up the line. Another graphic description for you.
And again, though, right now, no one's been able to figure out exactly where this is coming from or whether or not if it's a fruit or vegetable or whatever.
Correct. The thinking is it's maybe in the Midwest, it's more produce, not fruit. It's what they're leading towards. And in the national calls yesterday, the FDA, what they could tell us, they're leaning towards leafy greens at this point, but that doesn't exclude other produce.
Okay.
And this time of year, everyone's eating leafy greens. Okay.
Any other questions? Thank you very much.
Thank you.
Thank you.
Moving from one to another.
Yes, Member Corey, we can go.
I can do this. I can pronounce the West Nile virus.
Very good. Dr. Parker.
Good morning, Judge
Good
and
morning.
Commissioners.
Good morning.
Just to follow up on a couple of things that Russ said, while it isn't transmitted from person to person, it wouldn't be uncommon to see several members in a family with that because they've eaten the
They've
same
eaten the same
food.
food, right.
So I just wanted to point that out. And then also regarding treatment, if you are allergic to the sulfa drug, there are other antibiotics that can be used, but the efficacy of treatment is inconsistent. It's not as good as with Bactrim, but for special populations, especially those that may be immunocompromised, who would be at risk for more severe disease from that, there are other things to use. It's just that the treatment results are not as good.
Thank you.
But anyway, fortunately, to move on to West Nile virus, I don't have as much to report as Russ does. As of July 26, we have tested over 2,000 samples, and there have only been 5 positive mosquito pools to date. 2 of these were last week in the city of Grapevine, and the city has responded, and that did include ground spraying. We have still only had 1 human case reported, and that was early in June. And I'll be happy to answer any questions that you may have.
How does that compare to do you have statistics that say at this time last year how many cases that we had? Or
At this time last year, unfortunately, we had many more than that. And so end of July, beginning of August, off the top of my head, I would probably say that we had between 50 to 100, but I didn't actually pool all of that
Right.
data. But it was a significant difference.
okay. Any other questions?
Just an observation. I was in California over the weekend, and they are too talking about the West Nile problem. but they're focused on spraying. There was no discussion of larviciding. There was no discussion of testing of mosquito, what do you call them?
And doing the trapping.
Yeah. Yeah, they would just identify an area that seemed to have more than the standard number of mosquitoes and just start spraying. So our program is a lot further along than those stations that I listened to both in San Francisco and in Los Angeles. So congrats. We're doing a good job.
Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you, Doctor. Members of the court, if we could go to item D. This will be a discussion on county cash balances. Ms. Tidwell is here to address the court at this time.
We prepared for the court's review and discussion a document that outlined what the appropriate levels of reserves for the county might be. We started with the general fund and looked at the reasons why we would have a reserve, certainly to make sure we had short-term cash flow that's needed to protect the county's creditworthiness, to have sufficient resources should there be a need for reserves. The recommendation is 10% as a floor. The court could certainly address, as they move through their discussions, for the budget, whether or not an increase in that would be appropriate. I'm not going to go back through everything. We did meet with each of the individual court members to make sure that we had discussed our work and answer any questions they had. In the document that was provided, we outlined by fund the various amounts that we thought would be an appropriate level for the reserves in that fund. Outside of the general fund and the road and bridge fund at the 10%, we did then also speak to the health insurance or group health insurance fund and are recommending a fairly large reserve there related to just the Affordable Care Act and all the uncertainty associated with health care. We continue to recommend a $5 million minimum reserve in the undesignated balance. And we provided to the court some information related to our actual cash balances and the various types of funds that we have and those balances. Based on our discussions, we came up that the county is currently adequately reserved at the 10% in the 2013 budget that was adopted. We had 10% or slightly more than 10% for our reserves. The county continues to be in a strong financial position. There is no reason to have concerns other than just to be prudent and good managers of our funds and make certain that we do keep those amounts that would be necessary set aside. And with that, I'll be happy to answer any questions or any comments that the court would like to make related to the work that we did.
What about the recommended cash balance in the debt service, self-insurance, workers' compensation, and employee group insurance? Are we there yet? Are we there at the threshold, the recommended threshold?
Yes, we either are or will be. Again, because those are smaller amounts, so they're not difficult to achieve.
Okay.
And Renee, I want to thank you for working on this and for your folks that worked on this. One of the things, in kind of looking at this from at least my perspective, I was just hoping to get a handle around where are we, what do we think as a court, do we think are adequate reserves for the different areas, and that I hope will be something that we review on an annual basis, and from that, and at the same time, know. The one thing I would call your attention to, just as a kind of an effort, this sheet that starts out right here with the blue and the green, and it says at the top, cash investments. That, to me, is an important sheet. The one that has said, this right here was our cash carry forward. This will show us that, kind of how we ended 12 and started into 13. This was the one where, this one that says recommended reserves and undesignated calculation budget at the top shows how they arrived at what they felt like was a recommended reserve. And then another one that I want to at least make you aware of is this one that says cash flow analysis. And I want to maybe start or at least talk a little bit about that. keep in mind that as we come to the end of our fiscal year on September 30th, that will be when we will have, for all intents and purposes, spent all of the tax dollars that we raised for that year. And so from really October 1st through the end of November, most of the revenue that will be coming into the county will be from fees, because the property taxes won't really start being paid until the very end of November, when you have those first installment of half payments. And we won't get that money in, for the most part, until the first part of December. The tax office will collect it, but they may not disperse it over to the different taxing entities until that time. So what this schedule shows is that this could be our lowest point of where we have started a new year. We've spent more than what we've in effect taken in. And so if we don't have a good cash reserve balance, then we've either got to go out and we have to borrow money, or we need to make sure that we have that. So if you'll look at this little schedule right here, those numbers at the bottom show at 12, 11, and 10 what they felt like would have been the low point, or was the low point, that we needed to have at least that much cash rolling over in order not to have to go out and borrow money from that perspective. And so that kind of went into their overall calculation, or at least it kind of validated that need for the 10%. The next schedule I want to kind of point you to is, I want you to, this schedule right here that says cash and investments at the top, and specifically those first two blue columns, the one that says general fund and road and bridge. If you see there, we had 60 and 15 million cash on hand at the end of last year. If you then take this sheet that says at the top, use of cash carry forward in fiscal year 13 budget, which is this schedule right here, 8.5 by 11. Use of cash carry forward in fiscal 13 budget. If you look over to the far right-hand side, you see that 60,612,000, and you see the 15,176,000. And that's the two numbers that are on those blue columns. What that says is, in our general and in our road and bridge, we ended the year with about $75 million. Now, they've just said that they felt like that our reserve for the general and road and bridge needed to be somewhere around $34 million plus the $5 million for what we have historically used as undesignated in our budget. So we had $75 million. We needed a reserve of approximately $40 million. Why? What did we do with that other $35 million? And if you look in that left column at the very top, you see that we took $24 million for capital, and we decided that we would pay next year's capital out of that. We also decided that we were going to spend about $3 million on a lump sum. You all remember that. Mm-hmm. And then down under the road and bridge in that middle column, we also said that we were going to keep about $10 million to help fund potential 2013 road and bridge expenditures. So if you add all that together, that's basically why, even though we had $75 million in there, once you subtract all of that, it brought it down to right at what this reserve recommendation was. And it just simply says that financially, we're staying with what that reserve is. And that's just, again, in the general fund and the road and bridge fund. If you now look at this sheet, this one that says cash investments at the top, and along the lines of the question you asked just a few moments ago, the first two columns, you see that general fund and that road and bridge, which we just talked about, the 60 and the 15. The next column over says debt service. Well, at the end of 2012, we had $1.6 million in there, and what they're proposed and what they've recommended, and again, they're recommending, the court decides, but they were recommending $1 million, so that means we've got about $600,000 extra left in there right now. If you then come over to those green columns, that first green column is non-debt capital. That's the capital that we have rolled over from year to year. The cash is sitting there, to pay for capital improvements that we had approved previously but had not yet actually done. The resource connection and the resource connection oil and gas revenue, those are, fund balances for that. That's cash left over in those two accounts. Then to your question about the insurance, the group insurance at the end of 12 was $9 million. I think the recommendation was around 8, but there's so many different question marks over what's going to happen next year with the new health care and all of that, that the recommendation, I think, is that 8 was where we would target maybe for the future, but at least for the next year or so, with us changing our health plan, with all of the question marks and things that are up in the air on the new health care, we want that reserve to build as best we can. And then you see the self-insurance and the workers' comp. I think both of those were targeted for $1 million, which says that in the self-insurance workers' comp, we may have a couple $100,000 left over there that's above that reserve, but it's not a significant amount. Now, these were all 2012, and as we start the budget, I think what we're going to see is a schedule maybe very similar to this schedule that we started talking about, that would say, auditor will tell us how much cash they think will be left over. We'll have an idea of what we've just kind of, consensus that we've reached on reserves. And then that difference will be what Ms. Snyder will say, okay, we've got capital of X amount. We think we're going to need X amount to maybe help fund our road and bridge. And from that discussion, we'll know whether we're staying within that reserve range that we've said we want to stay in or whether we haven't. Again, just a final reference to this sheet, that yellow column is kind of the combination of the blue and the green. And the blue and the green columns represent things that we have control over. I mean, there's not really anything inside of that green and blue that we don't make a decision about. When it comes over to that little salmon or pink or whatever you want to call it color, those are numbers in cash that we have, but we can't do anything with it. It's the fiduciary accounts that the county clerk and that the district clerk have. It's a lot of those types of things. But it is still part of the cash. And I have, been asked before, well, how much cash does the county have? And we could say, if you looked at the first two columns in the general and the road and bridge, well, we have about $75 million at the end of 2012. But if somebody looked at our financial statements, they're going to say, well, wait a minute, your financial statements say you have $201 million. So just be aware that we may have and come January the 1st, that number is likely to be very close to $1 billion, because we will have collected a lot of tax dollars, but we'll be holding on to them for the rest of the year. Likewise, at the same time that we're looking at that, we just need to know that our debt, we just had a payment of debt in July. So the outstanding indebtedness of the county right now is around $300 million, I believe, 301.
301, 585.
If you say so, I believe
It's
it.
in the June financials.
And but there was a July payment made, and so that the June financials likely shows about $316 million or $317 million.
Right.
So we actually made a July payment, and Laura's back there shaking her head in the right direction. So I feel like I'm
Correct.
But just know that we've got about $301 million, $585,000. Do we have cents on there?
No, sir. No, sir.
Left that we owe folks. And I mean, that's what I had hoped to have, and I again appreciate very much the work that you and your folks had going forward. And, I don't know what anybody else's thoughts are, but I feel like that their recommendations with regards to the reserves are appropriate. But again, those are decisions, the 10%, the undesignated that we have, the debt service, the insurance reserves, those are all decisions that as a court I think we make and then review hopefully on an annual basis. The one thing that this particular chart showed that is always something I'd like to see is that we bring in revenue and we have out expenditures, and that we're bringing in more than we're spending, which is always a good thing.
Excess revenues over expenses.
That's always a good thing. And so with that, I mean, those are the comments that I wanted to make about that, and I just appreciate, again, all the hard work that everybody did to go into that. And
Renee, thank you and your group very much.
I'd make only one other comment in regards to cash carry forward. Each year when we do the revenue estimate, it always includes an estimate for cash carry forward. Keep in mind that we're estimating how much cash the county will have as of September 30th back in July, early August, based on trying to get the July books closed. So it's an art, not a science, as far as exactly what that cash is. When we miss it, we always like to be conservative and miss it on the underside and not the overside, because then we'd be short. We've had some dialogue with some of the court about going ahead and projecting some additional amounts that might come in that we might find ourselves in November, so that the court can go ahead and spend those in the coming budget year. Because again, if we don't include it in the budget, if y'all don't approve it in your 2014 budget, for example, then you're not able to spend it. That's why they've always, for many years, there's been a line item for contingent revenue for you to have contingent expenses. But just want to remind you that it's easy today to look at what the balances were as of September 30th for cash carry forward, but that is an estimate, just like the revenue, of course. Amounts are estimates as well, but the cash is also an estimate based on the actual spending by the departments and all the other things that have to happen between the time we're working on that, which is now, and again, August 12th, when you meet, when Debbie will present to you the budget, which will include our cash carry forward estimate, and then we'll refine that, but it's still just an estimate. So there would be some softness to that number.
And I think last year, you underestimated cash carry forward by about $4 million. When you consider that's on a $450 million budget, that's less than 1%. So I think that's very, very good. But that money, as long as what she's saying is, as long as we include a contingent revenue and a contingent expense, then if that were to come in, and if we were to end up with, enough dollars over that reserve that we've just talked about, that we wanted to make an extra payment on the unfunded liability or do something else with it, then if we've got that in there, we can do it. If we don't build in a contingency revenue and a contingency expenditure, then we would be precluded from being able to do that when we get the final numbers. And just as we did last year, TCDRS said they would like to have those, if they did it, they'd like for us to make that contribution before the end of the year, calendar year. Historically, audit has had, has made all the adjustments and is pretty comfortable with the end of the year numbers by the end of November, and that will allow us the time frame in which to make that decision.
Renee, on the 10%, how many days does that cover us?
The 10%, if you go back to the schedule that we were looking at with the yellow and white on it that showed what our minimum needs would be to just keep the doors open during October and November, you were looking at around the $30 to $33 million that was necessary. So if you're sitting at the 34 to 39, you're looking at enough to cover that 60-day, that shortfall period where we're really not bringing in any significant amounts of tax revenue. So it's about a 60-day to answer your question. And again, you can find statistics. The Government Finance Officers Association will tell you that their recommended reserve is 16%, but that would also be for a lot of cities or municipalities that are more dependent on sales tax. And in economic downturn, sales tax is affected much more rapidly, and so their revenue stream is much more subject to being impacted. The county's revenue stream over the last several years, of course, has been stable and continues to be that way. Property taxes are the bulk of what we use to fund our expenditures. We have grant funds and other sources, but the property, we think the 10 is a starting point. It's a good floor.
I just want to lay out some ideas out there, and I'm just thinking out loud right now, really. If we look at the 10%, which is about 60 days, if we consider that a pretty comfortable level, then perhaps that could be considered the minimum amount. And then if we can talk about expanding maybe a ceiling, like a maximum amount, maybe to 90 days, for example. And then we can begin to accumulate cash and fund the cash reserves. And once we achieve the ceiling, then we can essentially move that money, that cash, to pay down our debt. I'm not sure how much interest we are paying on the $301 million, but I think if we can pay down our debt as quickly as possible, that would be a good financial management step. And then we can redirect the cash toward investments that would generate more economic activities, such as transportation projects and so forth.
So one thing I think we're probably closer to 90 days right now than we are to 60, because, 33 is what you said you would need under a 60-day. We're talking about having 39 in there, so that's a little bit more from that standpoint. And the one thing I think we ought to consider about arguing about paying off debt versus paying off unfunded liability is we pay off debt, that saves us maybe 3.5% to 4%. Historically, TCDRS has made greater than 7%, even when you take into account 2008. So we make more money with our money if we put it up toward our unfunded liability than we save by putting it against the debt from that standpoint. So, I think those are conversations, if we have extra dollars, that we want to look at toward that.
I got maybe a little different way thinking about that. And Renee and I discussed this, that and you brought up in municipal governments, I know when I was involved with city government, we had by policy a 20% reserve, and in practicality it was 25, and that was 20-something years ago when the city didn't have anywhere near the percentage of sales tax that it would have today, the city of Southlake. And I think most of the cities, I know in my area, maintain certainly higher than 10%, but it's really for those emergency things, not necessarily to pay down debt, but to, basically in case catastrophic things happened. And, you and I had a discussion about tornadoes and, some, which, obviously we had one here 10, 11, 12 years ago, or something like that. But,
well, and again, from our perspective, when we were asked to put this together, this is a starting point to start the type of discussion that y'all are having, and certainly as you go through the budget and you see what kinds of dollars are actually available, both from increases in revenue as well as what type of cash dollars are available, then we would certainly be willing to help support you in any way that we can to do additional research or answer questions about, if there's a desire to increase that amount of reserve, or if there's how you may desire to spend that money. You're in a very good position, obviously. It's a much better position to be talking about how you're going to spend what you have than worrying about how you're going to make up for what you don't have.
Much better than Detroit.
So that's, of course, what we want to continue, is to continue for y'all to be able to be conservative and to move forward and to have resources to cover whatever unexpecteds we might have, and to continue to prepare for hopefully those events that will never occur.
And maybe we are, we may very well be, if I look at 2 months, we've got 60 days worth of coverage in there, and we're basically talking about coverage of the tax revenue. Now, maybe that's not what you're looking at. The fee numbers, we're probably at around, just right now with days covered, as I said, we cover about 60 days. Well, that's about, that's close to 16%. And that's just at the 33. So if we're close to...
if you take all of the different buckets that we're suggesting having an amount in and compare it back to the true operating, we're at about 12.
12%.
Because you have money, obviously, again, in the other places we're recommending, like for the insurance and the workers' comp and et cetera. So you have quite a bit of reserve set aside. And if you look at it that way, you have 12% instead.
Well, but again, I think when you're looking at percentage, you're looking at budgeted expenditures, less
Yes.
some of those things. Well,
yes.
I would be more interested to look at it from if we're going to do it in numbers of days.
To actually go back and look at actuals?
Well, if we look at, because for one thing, I think we've got a big cash carry forward number in those expenditures. But even so, if we're looking at it in days, I think we're probably very close to between 20 and 25% in the number of days that we have in reserve from that perspective, if we had a big downturn in the tax. If we're looking at it as a percentage of expenditures, then I really think it needs to be a percentage of actual expenditures, maybe versus budgeted expenditures.
Okay.
And those are all things that I think as we move into the budget and we have the discussion as we begin looking at next year, that may be something where we say we want to address this a little bit differently.
Because the judge has asked us to update some of these schedules for what you're doing in the 2014 process, and in order to do that, we'll have to work with the budget office, the court, and certainly the administrator's office, and we'll be having some of these same schedules and looking at them in more current time than simply what things looked like last year. So,
thank you.
Thank you.
Thank you, Renee.
Members of court, if we can go to item E. This is the legislative update. Mr. Mendez is here to address the court.
Don't talk about
Got ahead of yourself there, didn't you, Mr. Phillips?
Good morning. I'll be very brief. As you probably read in the paper today, the transportation measure that was before the legislature during this second special call session failed in the House. It required 100 votes to pass. It only got 84. There were 23 people not present, but my conversations with our delegation today have told me that they're barely going to have enough people there to establish a quorum today. I think they're pretty much done. An email was sent out by Vic Soon from TRTC saying that there was going to be a reconsideration of the vote. I think that's highly unlikely at this point, at least based on what I'm hearing. They didn't even try to take a vote in the Senate yesterday because they knew it required 21 votes. They didn't have those votes. There's a possibility that they have those votes today, but again, if the House doesn't do anything, it's a moot point.
Let me ask, the HJR 2, which is what they voted down, basically, as I understood it, said that we're going to end the diversion of the nickel out of every 20 cents of state gas tax, and we're going to leave that in Fund 6. That had previously gone to education, and that then that difference was going to be made up from the excess in the rainy day fund.
Actually, Judge, that was in the version, HJR 2, that passed out of the House. When it got over to the Senate, they struck all of that and replaced it with their version, which was basically going back to splitting the amount of money from the gas tax revenue that was going into the rainy day fund, splitting it between transportation and the rainy day fund. They took out the end of the diversion part that the House had in their previous.
Yeah, you meant the natural gas, not the gasoline tax.
Yeah, right.
Okay.
So that was taken off the table when the Senate got a hold of it.
Did the bill as it was actually voted on yesterday, did it include a floor?
No, it didn't. But the enabling legislation, HR 16, which did pass both houses, did have a provision in there that allowed not a hard floor, but it put that responsibility on the LBB to establish what the appropriate amount to remain in the rainy day fund before the split occurred on an annual basis. So had HDR 2 passed, the provision that did pass in HB 16 would have kicked in, establishing that floating floor, if you will. What did pass in HB 16 that is not a part of the HJR was the establishment of two committees, one in the House, one in the Senate, a select committee to examine transportation issues, and they are charged with coming up with a report that is due to the legislature by November of 2014 to have this discussion, in more detail. If the governor signs the bill, that will move forward. But the other half, dealing with the LBB, establishing the floor for the rainy day fund, that goes away since HDR 2 did not pass. We'll find out today at 2 o'clock when both houses are to convene for the last time, at least for this special session.
So you don't think there is a chance for a third session?
Well, there's probably going to be a third session on transportation. Whether or not it starts tomorrow is a question. The speaker did make it very clear, he and some of his leadership members, that they would prefer not to come back tomorrow, that they need a rest, and they would prefer coming back in the spring, perhaps.
Did you have conversation with any of the members of our delegation that voted no as to why or what their thinking was on the voting no?
There were 3 different camps. On the whole, the Democrats tended to vote against it, and the bottom line was they want any use of the rainy day fund to go first towards education before infrastructure. They felt that the budget process this regular session did not adequately fill the gap that came out of the last budget cycle for education, and that any use of rainy day funds, that's in general. The second camp is the strong fiscal conservatives that don't want anything to touch the rainy day fund or the streams of money that feed the rainy day fund, because that should be used for emergencies. They don't want to see it used as a dedicated source for anything, much less transportation. And then there's a third faction that basically is confused by the whole thing and are not vote no just because they don't understand the issues in particular. So
I'm not going to ask you to classify who's in each one of those groups, especially since you got to that last group.
Yes. But that's kind of where it stands at this point.
I see Charles Boswell back there, his chief of staff for Senator Davis. Welcome, sir.
Senator Davis.
Thank you, Mark.
Yes, sir.
Finally, members of the court, if we can go to item F. This is the 2006 capital improvement program. Mr. Phillips is here to address.
I would like to update the Commissioners Court on 2 of the facilities management construction projects. First, the 1895 courthouse site improvement project. The demolition of the old civil courts building is moving along at a steady, workmanlike manner. The building should be down to the ground in 30 days or so, and after that, the basement will be cleaned out. The top 3 feet or so of the basement walls, which has asbestos on it, will be removed, and after that, the contractor will install the underground cistern inside of what's left of the basement. The landscape work and the new granite work that will make up the new west entry of the building will be publicly advertised for bid in 30 days or so. This morning, I have for you an updated capital budget for this project.
David, Mr. Phillips,
Thank you.
on the demolition and the rebuild, do we already possess and own the granite? Or is that not? Go ahead.
$1 million of it.
Is that all of it?
Yes, we have it.
Okay.
Now, what we don't have is it needs to be somewhat fine-tuned on the edges of it, and that's going to be done in the field. The folks come up from Marble Falls will come up when the project starts, and that's going to be another $80,000 to $90,000 worth of work. This document is a snapshot of the budget for this project. The total capital budget beginning from 2006, when we started this project, to when we finish, hopefully next year or so, will be about $10.5 million. This document also includes all the expenses going all the way back to 2006, and it also includes forecasts for what I think it's going to cost to finish this project. It also includes a change order number 1, which will be for about $212,000. Change order number 1 will be to the general contractor, and I'll present that to the Commissioners Court in a couple of weeks.
So you're looking at a completion date of about when?
Commissioner, we'll be bidding the last phase in 30 days or so. What's going to drive that is what the bids come in at and how long they think the contractors will take to do the work. I think 10 months to a year to do the work. There's a lot of landscape work, a lot of foundation, drilling of piers, ADA entry, a lot of grounds work to do. So I think maybe, I would hope we could finish this project in calendar year 2014.
You indicated, so the 10.5, is that, you said you've got four, do I have on here someplace that says what you're forecasting?
That is what I'm forecasting, that the project to cost, or hopefully a little under that, $10.5 million when the final bills come in.
And when we first started the budget process, what was that number?
Back in 2006, it was probably about 6 or 7 million. So it's come up because of things it took to get the job done.
Okay.
Moving on to the new Civil Courts building, I would like to ask the Commissioners Court to consider adding an angel to the east elevation of the building. Now that the building structure is taking shape, the project team members and others have made mention to me that the building is very prominent to the people who drive into downtown from the east on Belknap Street. The concern is that the east elevation of the building kind of looks like a back of a building, and of course, it is the back of the building. So, yes, sir. So the thought is if we place an angel, which we have a couple of spares, if we place an angel...
Right now, we have a couple of spares.
Yes.
We hope we're going to have a couple of spares.
And we place an angel in the middle along the building and on the elevation, it might improve its presentation. And I do have a little
Go ahead. I'm
sketch
sorry.
for you. This is not a rendering, it's a sketch, so it probably don't necessarily match, and we didn't pay all the money for that sketch.
Is it covering up?
No.
Well, it's covering up, I guess those were windows that it will be covering up.
Yes, Judge, it is covering up some windows in the stairwell. That's not a big deal. It looks like the angel will have to be sheared in the back. These angel limestone blocks are fairly thick and deep. We've kind of looked into it already. The masonry contractor may have to shear off half of it to get, to make a little less relief to the angel.
How are we doing on the budget so far?
Budget's doing well.
Can we find enough saving to pay for the cost of the new angel?
Yes, Commissioner. We believe the cost at this early stage of this angel installation will be between $100,000 and $200,000. Of course, we don't have a design yet, and we don't have any documents that they can actually go take off and bid some of the work. But we did, as a team, got together and kind of put a range on it. We did have some savings when we eliminated the canopies on the side of the building. That was about $150,000. So we do have some savings available.
You sure about that?
And I will tell you, I'm one of those ones coming in from the east side every morning and noticing that building really looms as you come into downtown. And I think something like this would help the attractiveness of them.
I agree.
Now, I would, as much as I do support this, and I think we need to do it, but let's be awful sure we get two on the front before we start cutting on them limestones for that one on the
We
back.
can always make one out of foam board if we had to.
Don't you do that to me.
We can get some foam. We got some foam left.
You got a full, you think you could get the Basses to paint a little angel up there? Well, I'm very, I think this looks a whole lot better than what we're seeing right now from that standpoint. And I know that what we've approved is what we're seeing, but I just think this will make that look a whole lot better from that perspective. And I think it would be a good expenditure. And then we have one angel left to put on eBay.
That's correct. I'm sure we'll have some buyers.
Maybe we can get $200,000 for the one on eBay.
Sure we will. That's all I have this morning. Thank you.
Thank you, David.
It's not a bad idea.
Do we need to have a motion? What do you need, or do you feel like you got direction?
I think we have direction.
I have direction.
To do this.
Come back with a price.
We need to bring some other stuff back to you as it relates to this angel.
As soon as I have a number, I'll bring you back a number.
Good.
That's all we have at this time, Your Honor.
Then we will recess our open meeting and proceed to our closed session to discuss items exempted under sections 551.071, 072, 074, 076, and 0.
Thank you, Your Honor. Members of the court, if we could go to the administrator section on item number A1. We're requesting that the court approve amendment number 7 to the Intergovernmental Cooperative Reimbursement Agreement with the Texas Commission on Environmental Quality for the Local Initiative Program of the Low Income Repair Assistance Retrofit and Accelerated Vehicle Retirement Program to amend the expiration date of the agreement and allow for advanced payment of funds.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Members of the court, if we can go to, we're going to do human resources now, and it will be item F2. Ms. Worthing.
Good afternoon.
Good afternoon.
It is requested that the Commissioners Court approve a temporary transfer of the Chief Deputy Constable position from Constable Precinct 8 to the County Administrator's Office effective retroactively July 18th, and there is no fiscal impact.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Under the DA's office, item number 2, requesting authorization for the county judge to sign the third-party proof of claim. I believe it was in the packet.
So what this is, we're requesting.
Is this that condemnation?
No, I'm sorry. This is the, Flonase antitrust
Litigation.
litigation. We just need the authority.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
All right. Item number 4, requesting authorization for the approval of a settlement agreement regarding John Thompson, Tarrant County, and Constable Precinct 8.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. What about number 3?
3 is been, we don't need to worry about it. It's been dropped.
Okay.
Number 5, we're requesting authorization for approval of a resolution and order authorizing the use of power of eminent domain, and there is a specialized motion that must be read.
Take off, Commissioner Fickle.
I move that the Tarrant County Commissioners Court authorize the use of power of eminent domain to acquire fee simple interest in a 0.24 acres, that's 1,059 square feet tract of land situated in the W.R. Eves survey, abstract number 500, being a portion of Lot 4, Block 1 of South Lake Crossing, addition Phase 2 in Tarrant County, Texas, labeled as Parcel 10, for use in a public project known as FM 1938, FM 1709 to State Highway 114, which is a project designed to promote public safety, to facilitate the safety and movement of traffic, to preserve the financial interests of the public in its highways, and to promote the national defense. And I move to authorize the Tarrant County District Attorney's Office to initiate condemnation proceedings to acquire this property for this public use.
Second.
A motion is second. Any discussion? I hope not. Please vote. Motion passes unanimously.
To promote the national defense.
Is that really in there?
That's all we have at this time, Your Honor.
I thought didn't we have to take action on this facilities deal?
Which one?
See it?
Real estate listing?
Highways and roads is part of the Homeland Security system.
Okay.
There being no further business, we're adjourned. Commissioner Fickus, I got some paper over here you need to,
IT Committee?
for you to sign.
Probably